channel. My name is Jacqueline, and I have a very special guest with me again. He's my surgeon, Dr. Beck. We've been through all of my skin removal surgeries together. I've had 5 done so far, and this is part 3 of a little series we're doing, and you can watch 1 and 2 down below if you happen to miss those.
Hi everybody. Thanks for watching the previous 2 episodes, and we're excited to hear some more questions from you that Jacqueline has here today. And I've been in practice now for 15 years, and this has been a real blessing to have Jacqueline, who's such a special person, here interviewing me. So thank you.
Yeah, thank you for being here. I know I get a lot of questions about skin removal a lot, and I share with you guys a lot about my journey going through it. And so I thought to get Dr. Beck's perspective of a professional kind of answering these questions for you guys would be good and helpful for you as well. So we're just going to jump right into it with the first question. So is there a specific or more typical order that people go through when needing multiple procedures done? Or where do you recommend they start? Or
You know, normally what I focus on first is the torso, and normally the abdomen, the abdominal skin. So I focus on the abdominal skin and the back skin. The procedures that we use is very individualized for each patient, and in Jacqueline's case we did what's called the corset trunkplasty, which really focused on the entire abdominal skin, and we even went around the back side too. So she had a lot to recover from, but she did fantastic. And so usually abdominal skins first. That's kind of sets the foundation, and then I proceed to an upper body lift where we remove the skin to the arms, and if needed, even the back, because a lot of women or men will have these back rolls. So trying to get that fat out from those rolls is challenging, and that would be stage 2. After that, it really depends again on your anatomy and what bothers you the most. Some people may say, I want to work on my breasts because they're down to here and I want to lift them up and give them some life. Other people may not have a problem with that, and it may be that we focus on their thighs. Mm-hmm. Or maybe their thighs aren't even bad and we just stop at that one point where we just did the upper and lower body lift. So again, very individualized.
Mm-hmm. The next question is, are you able to get pregnant after having skin removed from your stomach or having a tummy tuck, or how will surgery affect pregnancy?
It depends on where you are, how old you are. Having a lower body lift, we often tighten the muscles also to the abdomen, as we do like with an abdominoplasty. So when you've gained a lot of weight, not only do you have a lot more extra skin, but you also develop this push on the underlying anatomy where you can stretch the muscles out. So when you've lost that weight, we tighten the muscles, not really tighten the muscles, but we bring the tissue attached to the muscles together to flatten out your abdomen. The question is, can you get pregnant after this? And you absolutely can. Ideally, it would be really nice if you wanted to get pregnant before, but a lot of people want to look good and meet their significant other before they just get pregnant with all the, with the loose skin. So, I feel for all the people who go through or who are in this situation. So I would say that removal of the skin from the abdomen, lower body lift, corset trunkplasty, whatever procedure you undergo, you can still get pregnant. Now, if you get pregnant afterwards, it may stretch the skin out a little bit more, or it may cause what we call a diastasis recti to the abdomen, which causes a little pooch. That being said, it's not impossible to get pregnant afterwards. In fact, you very much can get pregnant. So.
And then if you did have a baby after, or get pregnant after you had it done, can you work out to reflatten it, or does it, you'd have to have surgery again to?
Well, a subset of those people who underwent the procedure, who got pregnant afterwards, may not need anything anymore. Mm-hmm. They may still look great.
Right.
Even if you gain weight or lose weight, often your abdomen is still very flat. Mm-hmm. But then there's also a group of those people who unfortunately stretch their skin out again, or develop a little bit of a pooch after stretching out the muscles after pregnancy. So I think that it's important to speak to whoever your surgeon is and discuss these things with the surgeon, because it's very individualized.
And the next question, if you go through an extreme amount of weight loss, is it possible for the skin to go back without surgery, or is surgery the only way to get rid of the unwanted loose skin?
If you undergo a large amount of weight loss, it is really difficult for the skin to retract back to what it was like beforehand, because the skin, you've almost built new skin to be able to accommodate your body and your being overweight. So when you lose all that weight, the skin will retract some, but it may not do it nearly as much as you want. So most often it would require some type of skin removal. And this is the same thing for somebody who hasn't lost a huge amount of weight, just got pregnant and then delivered, and then some of those people, their skin rebounds like that and they look amazing. They're just so lucky. And then you have other people who are just the opposite. They have lots of stretch marks and thin skin, and so nobody knows for sure, but most of the time you're going to need some type of a skin removal.
Right. After you've lost a lot of weight and you have the skin, I get asked all the time, is that because I lost weight too quickly, or is it just because I was so heavy and lost so much that I'm left with the skin? Because a lot of people think it's because when you lose weight quickly, you're left with the loose skin, opposed to if you lose it during like a long period of time, that you wouldn't have the skin.
I think a lot of it depends upon how heavy you were, for how many years you were heavy. And then how heavy were you? How much weight have you lost? For example, in Jacqueline's case, she lost 350 pounds. So that's a huge amount of weight to lose, and it would be almost inconceivable for the skin to retract back, because you lost weight, but you took how many years?
It's like 3.5.
3.5 years to lose all that weight. So, you know, in your case, it did not, it would be almost impossible for the skin to shrink up.
And the last question is, what happens to the skin after it's removed? And can the skin be donated to like burn victims or after that? I thought this was really interesting that I got this. So, like, a lot of you ask this a lot of times, so I thought I would ask you about it.
You know, being in a private practice, normally the skin that we remove is thrown into a biohazard bag and disposed of. I suspect that potentially it may be something where we can work with trying to contact somebody who may be able to donate it for burn victims. I know that in the past, when I used to do tummy tucks earlier on in my career, I had a guy who used to come and collect the skin from the abdominoplasties, which are tummy tucks, and they would do research on it. So, you know, there's all kinds of different options. I think that that would be something that, you know, I could look into, or whoever you're seeing, you could ask the same questions.
So I hope you guys enjoyed watching this video. Like I said, this is part 3 of a 3-part series. So videos 1 and 2 will be listed down below. If you guys haven't checked those out, make sure you go watch those as well. And a special thank you to Dr. Beck for doing these videos with me and answering your guys' questions. I hope you found it helpful and learned something new. And yeah, if you have any other questions for us, leave it down below as well in the comments, and we can do another Q&A type video again soon.
Yeah, thank you very much, Jacqueline, for having me, and we look to try to be of assistance to all of you undergoing or thinking about undergoing these different procedures. And this is real, this is authentic, and we hope that you enjoy watching as much as we hope, or that we enjoyed actually making this video for you.
So make sure you're subscribed to my channel. Give this video a thumbs up if you want to see more videos with Dr. Beck, and we'll be sure to do some more for you guys soon. So thank you so much for all of the constant love and support. I truly appreciate it. And again, thank you for being here with me.
Yes, thank you.
And we will talk to you guys very soon. Bye.
Thank you.